DentalFuel, the podcast that focuses on what no one else is talking about: mistakes. The dental world is full of before and afters, and no one is talking about the middle. DentalFuel brings you the unspoken in between. DentalFuel is brought to you by Ignite DDS Coaching, empowering dentists to build self-determined futures. Together, we're shaping the next generation of leaders in dentistry. Dr. Justin Moody has been around for quite a while, and he knows a thing or two about building and growing a team. Currently, he has a huge team helping him at Implant Pathway. In this episode, he talks about some team mistakes. Let's listen in.
Justin, one thing that I think about dentistry is one of the hardest things about dentistry across the board, surgical, not surgical, is managing those complications. So I think that that's great that your residents get to see that, but I think that it's great to also obtain that knowledge through your course. I want to go back to something that you mentioned, and I'm just switching gears a little bit, but you said that your team is, or the team that helps at the clinic is around 33 people, which is a huge team. And I'm sure that you have worked with different teams along your way in your path in dentistry, but I'm curious if you've had any challenges or struggles in managing, and mistakes in managing such a large team or building a team to that proportion.
The answer is yes. There's there's a little different set of problems pre and post COVID. Post COVID, we had the really a very high mass exodus of nobody listening to this probably is this is a shocker, but we had a mass exodus of hygienists from the profession for early retirement, just stress, and somewhat in the dental assistant field as well. Had people leave and just not come back to it, and then we have inflationary things going on, and the escalation of wages, because you're in a more competitive environment. So those are staffing challenges. But what I think is I always believe that the people that you need will show up in your life. And for us, we've been very fortunate in we have a clinic manager. Her name is Marcy, and she was working for a large DSO. She worked there for 12 years as an office manager, and she learned great skills and systems and things through that. That's one of the things that DSOs do an incredible job with is training their front office teams, to be efficient, and language skills on the phone and things like that. But really, I think one of the biggest challenges I have for managing a team like that is getting leaders to step up and to lead. So you could imagine, with 33 people, we have an office manager, we have a front desk lead, we have sterile techs, we have a sterile lead, we have dental assistants, we have a lead, assistant, and then, we're very fortunate we have 2 hygienists. We could use 5, but we have 2 that are with us, and and then, and I'll finish up the team. So we've got, I think there's 7 in the front desk, and we got Marcy, and then we've got 3 sterile techs. We have 12 sterilizers. When we have a course going on, it is organized, but it's chaos back there. And then all the dental assistants, and then we have 3 dentists that work here full time as dentists. And then we have 4 residents that work here full time, but they won't be here forever. So the clinic is staffed by 7 dentists every day, and the challenge is our leadership, because you have, I call it the 3 factions. You have dentists, you have hygienists, and then you have auxiliary. But the auxiliary really lie in front desk faction and your dental assisting faction. And they're all great humans, but they the challenge in leadership is getting all those factions to actually work as a team, because like on a daily basis, like hygiene gets behind, the assistants have to do all their sterilization, they get pissy, like front desk doesn't schedule well, they lose a lunch, like now a DA is mad at the front desk, and like, so like the dynamic and how you operate it, I think, is finding natural leaders to step in and to massage that group into a cohesive unit. And at that size, like people come and go out of that unit. People move away, they get better jobs. They like what, sometimes personnel don't fit and you've got to make the change. And that's the challenge. The humans, they all do their jobs. They all do their jobs exceptionally, but the challenge is getting them to all do it together because they all have a different mindset, right?
Thanks for tuning in to another episode. Next week is our last episode of DentalFuel, and with our guest, Dr. Justin Moody. Ready to take the next step in your journey? Book an intro call with Ignite DDS Coaching today and level up your future in dentistry.